Hello and welcome to Health Matters on Channels Television. Thanks for staying with us again. I am Mary Alale Yusuf. About 9 weeks into the coronavirus epidemic, there are now more than 100,000 cases of COVID-19 worldwide. The global death toll is just over 3,400, but more than 53,800 have recovered. By March 5th, 8 provinces in China had not reported any new cases in 2 weeks. The number of reported cases in the Republic of Korea is also declining, and the current cases are from identified clusters. Off the coast of San Francisco, thousands of passengers are being held in quarantine in a cruise ship, the Grand Princess, where a 71-year-old man died of COVID-19. Now 21 others have tested positive. Nigeria still has 1 confirmed case of COVID-19 in the infectious diseases hospital at Yaba in Lagos. The WHO is asking every country to act with speed, scale, and clear-minded determination. My guest is infectious diseases expert, Dr. Iorhen Akase from Lagos University Teaching Hospital, Idi Araba. You are welcome to the show again.
Thank you very much. Good to be back.
Thanks so much for coming.
Yes.
Now we're seeing a great number of people who have recovered from this illness, almost 54,000. That is wonderful news. How long do you think does it take a person to recover once the person gets infected?
Okay, so the duration of symptoms varies from person to person. Also depends on how severe the illness was in the beginning. You know, when people come, we classify them into mild or severe disease.
Okay.
So people with mild symptoms, most people the symptoms resolve within a day or 2 or 3, within a week symptoms resolve. What keeps them from going home is when we run the tests over and over again and make sure we get 2 negative tests before the person goes home.
Okay.
But in my case, most times, even when they're in hospital, you see them moving around, they're doing great. So, but if it's a severe disease, then of course it means they stay longer and all of that. So weeks, 2 weeks, 1 to 2 weeks is the average duration that people stay in hospital.
Okay, that's good to know.
Yeah.
Now, experts say that to minimize spread, the air inside the containment center shouldn't get out, at least not the way it is. It should be maybe modified and everything so that somebody else doesn't get infected. How is this working in our containment center in Yaba?
Okay, so the ideal thing should be that you should, in isolation center, should be contained. The air, like you rightly said, shouldn't just be allowed to escape, especially if you are talking about airborne or aerosol transmitted diseases. COVID-19 is not.
It's not airborne?
It's not an aerosol or typically an airborne transmitted disease. It's a droplet.
Droplet. So droplet is different from aerosol?
Droplets are different from aerosols.
Because it's heavier, I guess?
It's heavier, they're bigger in size and are heavier, and they don't travel so far.
Okay.
So the practical or pragmatic way of doing it is to allow ventilation, a lot of ventilation to go. In fact, even protects other people coming into the room to allow that proper ventilation should flow in and out of the room. So in Yaba, what is available is the wards in Yaba are well ventilated. Since we have one person, since there's just one person there at the moment, that is not so much of an issue because there's proper ventilation, and so it's not a negative pressure room. In other words, air is going in and coming out freely.
So negative pressure at this point is not needed?
It's not needed, yes.
Okay, are we equipped there to handle patients with respiratory problems? Do we have respirators?
Yeah, so there's some specifics I will not be able to get into for obvious reasons, but what I can say is that the Lagos State government is really working very, very hard to put in some of these structures in place. And without getting too much detail, I can tell you that the commissioner and with the governor, support of the governor and other stakeholders, are putting in structures to take care of eventualities like that. I know people have been trained. The machines are being procured. They are available. Like I said, there are some things. I mean, I'm not in position to give too much detail, or I'm not allowed.
So we'll let you have that.
Okay.
But I'd like to ask, how is our index case doing now? What are the improvements or otherwise from, let's say, 2 days ago till now?
Yeah, so like I said, the commissioner has also mentioned it to the press. The index patient was a mild case of COVID-19. The indicators for mild case, he's a young person, he doesn't have any other problems, and within 2 3 4 days, the symptoms had basically resolved. Currently, I'm aware that he's being kept to just make sure that all his tests turn out to be negative. When that's going to happen, I cannot say. But so he came in with a fever, joint aches, and I think he had a dry cough at a point in time. All of these have markedly improved. In fact, at the moment, he's doing quite well in that aspect, in the sense that the fever is improved. All of this, the commissioner has said before, fever has improved, his cough has improved. So there's nothing in his clinical state at the moment to get concerned about.
Okay. So we saw a couple of 20 of the most asked questions about COVID-19 on Google, and we curated a few of them here. I'm just going to ask a few, which are, questions that will never grow old, really. Yeah. Like, what are the symptoms of COVID-19?
Okay, so the symptoms of COVID-19, the commonest symptom is fever. The next commonest symptom is a cough. Now, that's what's peculiar about this particular coronavirus. Most other coronaviruses cause a catarrh.
That's
primarily
right.
Fever and a catarrh. But for COVID-19, we have not seen catarrh means nose
it's
discharge.
Running.
Yes, running nose and all that. For COVID-19, that doesn't seem to be so common. The commonest symptoms are cough, catarrh, and then in some cases, some difficulty with breathing, chest pains, and then joint aches, non-specific symptoms, and that. So the commonest symptoms, of course, is cough and a catarrh. And now, those symptoms then get interpreted in context of where the person is coming from, or whether he has been in contact with someone. So in assessing, that is the most important thing. Has he been in contact with someone? Is he coming from a high-risk area? Any other symptom that he now has is probably now just... so we don't use symptoms alone.
Yeah.
We interpret it in the
light
light
of
things
that
in the light of where it's coming from and who he has been in touch with.
Okay. Another thing that people want to know is what can kill the coronavirus? Yeah,
so the coronavirus, because it's an envelope virus, it's an envelope virus. It's rather unstable.
Okay.
So basic detergents, once the envelope is, is affected, it doesn't survive for much longer.
Basic detergents.
Basic cleaning
so if
detergents.
we clean our surfaces at home with detergent,
yes,
we are safe.
Yes, at least that's at home. We're talking about home cleaning. Yes, that's basic home cleaning. Stuff is good enough to take care of.
Somebody came and said, "Oh, I heard alcohol can kill the coronavirus." And I had to tell the person, "We didn't ask you to drink it.
To drink, that's the thing." So
just
I know
use
the
it in your sanitizer.
Yeah, the interesting thing, the alcohol that people drink. I mean, even the strongest ones, the spirits, I don't know, they're like, 30, 40, 50%, But the alcohol that is required, we use for hand sanitizer, is 70%, 69 to 72%.
There you go, really deep.
It's deep, so it's not your average drinking alcohol.
So let them not go drinking alcohol. Okay, so another question is, how does it spread?
So the commonest way of spread is by droplets. Like I mentioned earlier on, when somebody sneezes, the large particles can drop on your face or your mouth, and that causes infection. So droplets which don't go far. Which don't go far.
So if you're far enough, you're safe.
You're safe. Yes.
All right.
Yes.
Okay. So what kind of safety measures should we be seeing at offices and schools so that we bring it home to the people?
Okay, so in office and schools, the major thing that has to do with you have a large group of people coming together in one place. So the first step is, like they have been said over and over again, teach people to observe hand hygiene. Wash your hands as frequently as possible. Whenever you touch something or you've gone in a public place, touch things, touch money, touch doorknobs, come out of a taxi. Before you go in, don't touch, wash your hands. Come back for a toilet, wash your hands. Anytime your hands get to touch things around, you should do that. That's probably one of the most important things of ways of controlling COVID-19 in the public space. Now, the next thing is someone has symptoms. He has to be taught to stay at home or go to hospital, and then taught on how to do cough etiquette, which is don't cough into your hands or sneeze into your hands. Use a disposable towel, or if that's not possible, cough into your elbow or sneeze into your elbow. This go, and then as frequent as possible. Once you do that, get to wash your hands. And someone who has symptoms and has to go out, you give him a face mask to wear so that he doesn't,
transmit it to other people.
Yes.
So let's say somebody does this and has these symptoms and stays at home the way you say he should stay at home, and it's getting worse. What should the person do?
Yeah, so generally with anything, once you have symptoms, no matter how mild you think they are, once they are not getting better, you should be able to know who to call.
Okay.
Or
they shouldn't come out. He should call.
You should call. Get in touch with someone.
Okay.
Now that becomes more expedient if he has been in touch or traveled to a place that have active community transmission of COVID-19. That becomes that. But if he hasn't and others are not there, he should be able to let somebody know, oh, I'm getting worse, and that should be in the country at the moment. Since we don't have COVID-19 transmission within the community, if you have not been anywhere, you're not in the hospital for now, there's no reason to think that you can. Well, I say that with some
caution.
Caution. There's no reason to think that, but if you, just because you have respiratory symptoms at home, you're not being anywhere, nothing, you should think COVID-19 first. But like you said, it's always better to call. A medically qualified person is in a better position to reassure you and do that.
Now, taking from what you said, a lot of people will come down with symptoms and they just go to their regular doctor.
Yeah.
They go to their hospital.
Yes.
Now, what should a doctor be checking for before he begins to suspect this could be COVID-19?
Yeah. So a lot of training is going on around with doctors at primary healthcare level for them to be able to know the definition criteria that the NCDC has released. In someone, so for your doctor, as a doctor, when someone comes to you with respiratory symptoms that qualify for that, that's the first thing that you make. And this season, you should, once somebody comes with symptoms, you should go on to the next point. Okay, where have you been? Have you traveled recently? Have you been in touch with someone that works? So right now, since we have a case, people that work in that center have been in touch with that patient. I mean, they theoretically can't transmit the disease to someone else, in theory.
Okay.
So if, for example, you get a history, oh, my brother, my friend works in IDH or something like that, you should be able to think, oh, could this be what we're dealing with? But just in a community like that, if you have only symptoms, no contact, no travel, no history of that, then you shouldn't typically at this moment be thinking COVID-19.
Okay, so we escalate this by making a call.
Yes,
I believe that those phone numbers will soon come up, that the hotlines, yeah, there they are, that people can call to ask IDH to take over.
Right.
Now, India has restricted the export of 26 key ingredients of commonly used medicines. How does that affect us? Because it's a big issue now on the world stage.
So you see, this is an issue that, you see, when people said we should have stopped people from other countries or stop going from other Nigeria in order to mitigate the risk of COVID-19, these are some of the issues that have to do with that.
Okay.
Now, when countries, on account of COVID-19, stop exports, or you say things like that cannot come into their country, I mean, you remember, we are not, now it doesn't mean as if all other sicknesses have stopped and it's only COVID-19 that is in the world right now.
That's right.
There are other ailments that are going on, and so what happens is there's a displacement of attention and priority from other areas. So it means that people are going to die from, right now we have measles still going on, polio, upper respiratory infection, other things, Lassa fever, all of that are not waiting for COVID. Mm-hmm. So it means that implications of reactions like this in response to COVID has the potential to adversely affect health outcomes that are from other conditions.
Okay, I'm going to stop you there. We'll continue this conversation when we come back from the break. Please stay with us. We are coming back shortly. Welcome back. We are still talking about COVID-19 on Health Matters on Channels Television. To ask any questions, you can call 0805-468-3514. That's 0805-468-3514. You can also tweet at CTV_Mary A. I did see somebody handing over a hand sanitizer, I guess made in Nigeria, to the Minister of Health. Could this ban on exportation be a secret boom for us?
Yeah, and I see that's one thing the WHO, the general, was saying recently, that even though we're responding, COVID-19 is an acute threat, and we should respond to it appropriately. What sometimes outbreaks do for health systems, sorry about that, is that they strengthen health systems.
Okay.
So going forward, you can see, like I can tell you authoritatively that most institutions and most people are producing their own hand sanitizers now, which was not a big deal to do. Now with the scarcity, I'm aware that some people are even locally producing face masks and all of that.
Okay.
So going forward, what threats like this do, even though it's unfortunate, we should be able to prevent them from coming. But when they do come, at least one good thing they should do is to strengthen health systems, strengthen economies to better respond next time, which means that the capability or capacity to diagnose, to manage, to produce the necessary resources that take care of this, we should be better prepared. And going for the offshoot would be that it's better for the economy, better for the people in the country, being able to sustain themselves. I mean, we saw from the Ebola, most countries needed to import medical personnel to come take care of it.
Yes.
Now, most countries have capacity to take care of this when they come up, and they produce their own resources that they need. So it should be a good thing going forward.
But what's this we hear about people not being tested because they don't have enough test kits? I mean, in America, not enough test kits. First of all, let's take this phone call. We'll come back to that. Okay. Hello. Hello, Eddie?
Hello? Hello? Hello?
Hello, Eddie. You have to put your TV off.
Regarding the cause of this coronavirus and the immediate cause.
Hear you here.
Okay, let me do that.
Quickly, please.
We want to know the immediate prevention. Is it running loose? Is it coughing? Let us just know the immediate prevention of this corona, what do you call it, COVID-19.
Okay. Thank you, Eddie. I heard immediate prevention, and then I'm hearing symptoms.
Yeah, I also didn't sort of get that clearly. But I'm thinking what probably is happening is that what is the immediate way of preventing if someone is coughing? I mean, well, I'm sure you can get information in there somewhere. So, like we said earlier on, if you know somebody who is coughing, whether it is COVID-19, whether it is influenza, whether it is tuberculosis, you know that a cough, if it's infectious, in coughing you can transmit it to somebody else.
That's right.
So COVID-19, whether it's COVID-19 or not, you should teach people cough etiquette, which is that don't cough into your hands. If you do that, if you sometimes unconscious people do that, you make sure you go wash your hands immediately, or you use hand sanitizers. Because when you do that and you rub it on your trouser or your shirt, or you shake somebody else, or you do that, you are putting other people at risk. Knowing that there are other more dangerous pathogens than the coronavirus we're talking about right now. So it's something that should be part of. So when someone is coughing, they should learn. We teach our children, let them grow up with it now. We teach them in schools to know how to do this. Okay.
We have Emmanuel calling from Imo State. Hello, Emmanuel.
Hello.
Hello. Question, Emmanuel. I think we lost him. Okay, so let's continue. Now, test kits.
Yes.
Do we have enough of them here in Nigeria?
Yeah, so the most time the issues with test kits, I know WHO have mobilized test kits to countries, various countries. Now I don't know the dynamics of what's going on in the US, in America, but the availability of test kits and the protocol they're using, who are they testing?
Yes.
Are they testing everybody coming to the country? Like I said, I don't know what protocol they're using. But for us in the country, we're screening. So when people come into the country, like we said before, into the country, they screen by temperature and by the questionnaire they serve, where they're coming from, who they've been in touch with, and all that. So we classify risk. And I think it's important to say that you can't just go screening everyone. I mean, we've had people come to us in hospital and said, I was on a flight that came from Istanbul.
Okay.
I want to get tested. You know, people like without symptoms. So if you test them at that time, they're negative, you waste the kit.
Okay.
So you don't just use symptoms when they're symptomatic or you feel that okay, it is because the fact that you tested someone as negative does not mean it's not going to test positive later. So you might as well optimize how you're testing people. So all of these are things. So like I said, I don't know how, but I know WHO has, and lots of countries, a lot of companies rather, are producing these kits now. It's not just one company. So I'm not clear. The picture's not clear to me why the US is saying they are run out of test kits. In the country at the moment, we are not having that experience.
How do you react, and what is the implication of somebody who comes down with COVID-19 and you cannot trace any contacts? There are a few of those now.
Yes.
Somebody in Britain, someone in America, someone in Canada, no trace whatsoever. What's the implication?
So there are two aspects to this. One, in one situation, in one scenario, you have someone coming down with this scenario you painted in a country that's having active community transmission of a known link. So, for example, someone will know that someone came from China or from Italy into a particular country, brought in the first cases, and so we're not having transmission within the community. Then we have someone who came, we can't point to who gave it to him.
Yes.
It's a different scenario. You could say, okay, maybe he can't remember how, maybe he touched the doorknob without knowing, someone touched it. So in that case, we know that inanimate transmission can occur. So he went somewhere, somebody had sneezed on the table and gone, and he didn't know. It's an object he touched and touched his face. So he can't explain.
Okay.
So in that kind of scenario, it's one side, he probably puts it down, he doesn't know how he got it. You have another scenario where you cannot link who brought it from China or from Italy or where those countries in there. We have that scenario in Iran where they cannot trace how it got into Iran in some places. Okay. And then the strain, well, Iran's case is peculiar in the sense that the strain of that one circulating in Iran is also different.
Oh, it's a different strain?
Yes, it is.
But we're running out of time, so let me quickly ask you, what can we learn from China? Their cases are going down.
Yes.
Meanwhile, Europe's cases are going up.
Yes.
What can we learn?
So, well, in China, well, a number of things we can learn from China. China, I don't want to go into politics, but they had the apparatus to be able to clamp down or lock down on cities. With the extensive transmission going on, they did a lot of decontamination, lockdown on cities, responded appropriately. In fact, China's response was very impressive. In this light of the circumstance they were facing a large outbreak that no other country has faced since this outbreak started. And some of the actions they took were, some people call them draconian, but they were quite drastic, which may be difficult to implement in Europe and elsewhere.
Oh yes, oh yes.
Because of all the issues, legal issues.
Measures.
Yeah, some of those measures. So I think one lesson we can learn from China is, one, their willingness to do whatever was necessary. Some people may look at it as, why did you do that? But they did whatever was necessary for the security of the country and the world at large. They kept the cases in, took the heat initially, but in doing that, and I think that was very selfless on their part, really. But then, like I said, that kind of response, I don't know how possible it can be, let's say US or in Europe, for example.
Well, we hope it doesn't get here, but it goes to show that some people have to step up their game, it seems.
I agree
because one case anywhere is danger everywhere.
Everywhere, I agree.
Thank you so much for coming to the show. It's been wonderful having you.
Always good to be here.
You have a great day, everybody listening at home and elsewhere. I am Mary Alale Yusuf.